And Carmel Angelo and I have worked on that. Carmel, would you like to present?
Sure. Thank you, Sheriff. You have, Dora kindly put the agenda summary and the Lee Kemper contract in your packet, so you should have them. And we do have, this segment of the board meeting on this one item, the Lee Kemper contract, is a 30-minute item. And I can tell you that basically what happened was that the board made a couple decisions. One was they did not want to move forward with the $40,000 contract because they thought that the statement of work was lacking. And if you look at the agenda item and you look at the contract, you'll see that the statement of work basically says including a mental health needs assessment. So they felt that that did not have enough definition to it. The second point was that they did not want to utilize this contract. They wanted two separate contracts. And what we said to the board was that to use this contract, then Lee Kemper could start work because we had a contract. And that if we were going to do a separate contract, then we have to go through the contracting process and it would take longer. So they want a separate contract, and mainly they want a separate contract because they want the money separate. They want to be certain that the public is aware, Measure B money is here, everything else is over here. So that was our direction to, one, work on the statement of work. It wasn't clear enough to come in with a separate contract. What they did agree to is $10,000 for Mr. Kemper to start the work, since he's already started the work, and that we would have this separate contract for $30,000 once that statement of work is completed. And that we would go back to the Measure B committee and talk with you about defining the statement of work, that it doesn't just say needs assessment. A couple other key points, and then I'm gonna have Carla just put on a brief 5-minute clip of this. But some of the other points were about what the board members thought should be in the needs assessment. And I think that, you know, it's questionable what the needs assessment should look like. And what we said to the board, what I said to the board is that in discussions with Mr. Kemper, the goal was to look at the system and a gap analysis of the system. It wasn't to come back and say, you know, we're gonna create a psychiatric facility, this is how we're gonna do it, we're gonna do county staff, we're gonna do contracts, whatever. Because that's jumping the gun. The whole point of the needs assessment really is to have a professional person look at our system and come back and tell us what we have or what we don't have. It wasn't to say, you know, to hire somebody to do a needs assessment and they're gonna come in and they're gonna say, okay, well this is, we know before we even start assessing that this is what you need. So I think we made that point clear, we talked with the board about it, but that was the decision they made. And Carla, you wanna just show, I'm hoping we can just show a few minutes at the end so you can see what the direction was from the board. And they're about 20 minutes into this now, and they've already had public comment.
Come on, mouse.
And so Scott, are we taping now? You already have us taped. Okay.
There's no mouse pad over here. Get down there.
No.
It's so close.
If it doesn't work, it doesn't work.
No, I got it. There we go.
Wanting this contract to be separated out. I don't know if what Ann Mulgard just brought up is another option. I did note, you know, again, going through the last meeting, that there was most of the discussion at the Oversight Committee was about the needs assessment. And of course, Mr. Kemper was there, and I think he has a good idea of what's being looked for in a needs assessment. I do agree that there isn't a lot of specificity here. I mean, I don't see it in the services agreement that was in our packet, and perhaps that's something that we need before we go about doing a needs assessment. We should, you know what we're talking about exactly. My main concern on this, though, is not with how the $40,000 will be tracked, because I think, I trust our administration to do that in a way that is transparent, and that if members of the public doubt how that is being done, I think we'll be able to show them the paper that tracks it and makes it clear that we are spending Measure B money on this very important exercise. What concerns me, and also I've been very impressed with the work that Mr. Kemper's done. I do think he's the perfect person to do this work. What concerns me more is that in the past, when we've hired Mr. Kemper and paid him a good deal of money, we have often not followed his advice. So I hope when we if we do go ahead with Mr. Kemper, and we don't have to go out for RFP, as Supervisor Jurdy pointed out, and Kemper is the guy who does the needs assessment, I just hope that what he comes up with meets the concurrence of a majority of the board, because frankly, 2 times he has worked for us, we've not followed his advice. So I just want to note that for the record. Supervisor McCowan.
Thank you. First of all, I appreciate the comments of Sheriff Allman. We do have a very much improved system. There's no question about that. I appreciate the suggestion of Ann Mulgard, and that might be a viable way to move forward without delay. And I think it's yet to be known if we've followed the recommendations of Lee Kemper, and that's why I want an agenda item reporting on his current existing contract, the first point of which was to assist the county in implementing the recommendations in his report. And there were some key ones there that I don't know that we've closed the loop on. So again, I think we need an agenda item for that. But that points out that this definition of services isn't the needs assessment definition of services. They've added the bolded language, 6 words, saying do a needs assessment. I think there does need to be a bright line on the spending of the Measure B money. I don't think it's a big deal to write a separate contract, the bulk of which is all boilerplate. But depending on what the board and county council and the executive thinks of Director Mulgard's recommendation, I would be comfortable approving a not to exceed 10,000 today with Lee Kemper to continue work on a mental health needs assessment, with the understanding that we will come back with a more detailed definition of services, at which point the contract would be extended to 40,000. So I would actually be comfortable doing that, because Lee Kemper is the ideal person to be doing this work. We don't want to slow it down. But frankly, it's a little disappointing that it's taken 4 months to get a recommendation in front of us for a needs assessment, and then it's as bare bones as it is. A good starting point, frankly, there was a matrix developed for the, I think the first Mental Health Services Act ballot initiative, and then that matrix was later updated. That's kind of a good starting point, I think, of here is the range of things that we might be looking at. So again, Kemper already knows what we have, so there's not a big challenge for him to come up with that. So I think starting with the gap analysis, what don't we have, makes sense. I think we can look at the matrix and see these are some of the things we could be providing. I think everyone agrees that, or most people agree, that the 24/7 facility is essential. I mean, that's, everybody kind of understood, if you're voting for this measure, that's the number one thing you're most likely to get. But there's also the model of residential crisis centers on a dispersed basis. Particularly, they could be coupled with the hospitals in Covelo, South Coast. There'd have to be another option. That's something that is worthy of exploration. So in addition to the gap analysis, I think what I would hope Kemper would be providing us would be for each gap and the possible method of filling it, what is the financial feasibility of that option? And in order to have a sustainable system going forward. So I think that can all be put on half a page or a page.
Okay, do we have other comments from board members? If not, I would entertain a motion. Is there any board member who'd like to offer a motion?
I would ask if, from county council standpoint, if there's any, and we know the executive can, as purchasing agent, either department head or purchasing agent can enter into a contract. Would there be any issue with the board giving direction to approve a $10,000 contract with Lee Kemper to continue the work of a needs assessment? And then the understanding would be there'd be a more defined definition of services, at which point the board would increase the contract.
Through the chair, Catherine
Yes,
Elliott,
please.
County Council. I don't see that that would be any problem in terms of the fact that this was brought forward and you're just amending what was brought forward, so.
Thank you.
So do you want to offer a motion?
With that, Mr. Chair, I would make a motion that we authorize the executive office to enter into a $10,000 contract with Lee Kemper to continue the work of a mental health needs assessment, not to exceed $10,000, with the understanding that the executive and/or the Measure B Oversight Committee will develop a more detailed definition of services and return to the board for approval.
Okay, is there a second to the motion?
I'll second the motion.
Okay, sure. Okay, very good. Any final comment on the motion? If not, we'll vote. I'm sorry, Supervisor Krosky.
Thank you. I just had a quick comment that, I'm comfortable with moving forward this way, but again, I don't necessarily like being put in this position where we're trying to hurry up and let him continue the work that has been started before the contract even came to us. So I have some concerns with that. I mean, we haven't seen the contract yet. I realize he has this ongoing contract, but this was kind of outside of the scope, in my opinion, of what that contract was supposed to be, and then it's coming to us, but we're trying to modify it to make sure that he can continue what's already happening.
Yeah, I share your concerns. Supervisor Brown.
So I'm the odd person out on this item. I fully support what has come forward. And we've had some recommendations from individuals that are very involved in the mental health Measure B committee, as well as our behavior health advisory committee. So I guess I will support what's going forward, but I would rather, I don't know, maybe I will vote no. But I do support the measure that's before us, so I'm very different than you, and I think we can trust these people to make sure it's directed in the right way. That's how I feel.
Supervisor McCowan.
Thank you. Well, I appreciate Supervisor Krosky's comments, and I think there's some confusion in the community possibly. The Measure B Oversight Committee is empowered to make recommendations to the Board of Supervisors, and I have a lot of respect for the people on that committee and the work they're doing, but it does need to be clearly understood. They are making recommendations. They are not making decisions, and it sounds like the decision over Howard Hospital is being made there. No, there will be a recommendation over where, if anywhere, certain facilities would be located. So, again, I appreciate the comment, and I hope it's taken to heart by everyone.
Well, it seems to me what happened here was that the waters got a little bit muddied because we already had a contract with Lee Kemper, and it was expeditious to just amend that contract rather than start over with a clean contract. And I do think that would have been better. But I'm also very sympathetic to what you're saying, Supervisor Brown, that I really respect what this Oversight Committee's doing, and the last thing I want to do is slow this process down. I feel like I've been assured this morning that the process will not be slowed down, and that we'll get a little more specificity in terms of what will be assessed in terms of the community's mental health needs. So I'm going to support the motion, but I have some of the same reluctance that Supervisor Brown has. So please vote by the button.
Motion carries with Supervisor Brown dissenting.
Very good, and we will take a break and
We're not taking a break. They took a break.
Yeah, so you saw what the vote was, and that they want a detailed definition of services. Supervisor McCallum talked about a matrix, an MHSA initiative matrix, and starting there. Though they do agree with Mr. Kemper, which is starting with a gap analysis of what we don't have. I think Supervisor McCallum said it about, you know, the 24/7 facility being essential and already getting to that point. And the possibility of the residential crisis centers with hospitals, looking at Covelo, South Coast, so basically having something that's more regional than central. And then, of course, for each gap, how to fill it, and the financial feasibility. And so, and then, of course, we have to return to the board. So with all of that said, last week, I was in Sacramento and I met with Mr. Kemper. And he had heard what had happened at the board meeting and wanted to know what had happened and, you know, how he should proceed. And so I told him that, you know, we have $10,000 in his contract. He's not concerned about the money, but that he can continue to do the work he's doing. And of course, why we went with that contract was so we wouldn't have to wait. And I think everybody knows that. So I talked to him about a more defined statement of work and some of the points that the board members brought up. And you didn't see that part of the meeting. It was about a 30-minute segment. But they brought up everything from, you know, the 24-hour facility, how that would be staffed. Would it be county staff? Would it be a contract? Would it be contracted staff? How would we do all this? And so I had that discussion, and, you know, quite honestly, Mr. Kemper made it really clear that based on his meeting with the Measure B committee, that he believed that what was needed and what was desired was a gap analysis. And he does not feel that he really is going to get into the minutia of how a facility would be run, would it be county staff, is it going to be, he doesn't want to get to that detail. He doesn't see that as his role with this particular project. And so I share that because I believe that right now, Sheriff Allman, that what this committee needs to do is to come up with an additional definition to the services, and we will share that statement of work with Mr. Kemper, but there's no guarantee that he's going to agree to it. And I mean, I think that we attempted to make that point to the board as well. But anyway, so that's really all I have to say on this one, unless there's questions for me. And if not, you know, we can take notes on what this committee thinks should be in the needs assessment.
I think that what we would have to have, and maybe, well, we're not going to do it through email, but what we need to have is what are we asking? You know, we don't know what we don't know, and between, you know, we're very fortunate to have the director of mental health on this commission because probably nobody knows what we need or what we already have in this county more so than Janine, and I think that's a great way to, you know, have a director of mental health like that. But to get a contract like this, there are many questions, and I think that history is going to look back and say, why didn't the needs assessment address, and then fill in the blank. And one of the questions is, if our psychiatric health facility, which closed in January 2000, if I don't believe it closed because of just lack of staffing, that was part of it. Some people say that's just lack of staffing. If it closed for lack of staffing, then is there something that we have to do to prevent that from reoccurring in the future and rearing its ugly head? So when I ask this, Carmel, I think I already know the answer, but do you know of any needs assessment request that would ever exist anywhere in our state where the assessment is, where the questions were what does our mental health system need and what do we have right now? Is there anything like that?
Sheriff, I would have to point to our mental health director and ask her. I mean, I honestly, you know, I don't know.
For whether there is, not that I am aware of, I think there may be some models that are maybe somewhat similar. Stepping Up has some pieces that looks at what do you have, where are your crossovers, what do you need to prevent your crossovers, how do you create more services, but that's really a diversion look at things, right? But I think there's some pieces to that that you can look at for a mental health system. We are a unique model because we have an ASO model, and the way that we our system is developed is very unique compared to any other county in the state of California. So I'm not sure that there's anything that specifically says that there's something out there that says here's what one county looks like, here's what their gap analysis was, and here's what they need. And I think what you'll find is there's a variety of counties that are in our similar boat. There aren't enough mental health services. There's a lot of counties looking for needing mental health staff. And then there's a lot of different opinions on what works and what doesn't work from a mental health perspective.
So the fact that we as a county have asked Lee Kemper to come in several times and work with mental health, and now to do a needs assessment, I'm going to go out on a limb and say that Lee Kemper, he may very possibly know the answers of what we need, because he's aware of, at a statewide level, of what mental health services are listed or provided throughout the state. I don't know if he knows every 58 county operating procedure, but he certainly has an idea of the certain services that are offered to mentally ill people, whether or not they're in each specific county, he doesn't know. And my suggestion is that we ask Lee Kemper to evaluate our services that we have, the history of where we've been, of the number of people that we have in psychiatric beds statewide, that go out of county, and to look at the number of people that we're serving, of our citizens that we're serving in county on regular day-to-day mental health services. And while we wouldn't know the private industry, we would certainly know the social service industry, the public payment industry, and say, if we give you all the information of what we're providing right now, can you tell us what we need to improve the services and to have these services provided in Mendocino County? I don't think it's a complicated question to ask him, because he actually probably already knows what we need, and he's going to question the people around his table as well as other providers around our county to say is how many and specific numbers and so forth. So I would be prepared to just ask the Board of Supervisors to trust Lee Kemper of evaluating the services that we have right now, either in county and out of county, and telling us what we need to do to improve these services, to take the pressure off of hospitals, emergency rooms, first responders, and some of our other resources throughout our county. Please weigh in, Ed.
A couple of things to direct to Carmel and whoever can ask. We, on this committee, were asked a couple of meetings ago to submit questions that we had, and a number of people did that. We talked about it at the meeting and sent them on to Lee. I had presumed that this would be part of what Supervisor McGowan talked about, a more detailed analysis of what he was going to cover in the gap analysis or the evaluation. So I assumed, you tell me if my thinking is right or wrong on this, that he would take the input from this group, anybody that submitted things and anybody else, and would be able to go over those and say, yes, these are questions that we will address in our analysis, or no, this is beyond what we're hired to do or what are prepared to do. So what we would know then when the report is made, we could count on these questions being addressed, and we would know which ones are not going to be addressed, so we could cross that off our list. Now, is that going to happen? Because I haven't heard any feedback from
Sheriff,
him that
through the
he's
chair.
doing that.
Yes.
Yeah, I'm correcting it to both of you.
Actually, yes, and in my discussion with him last week, Sheriff, what you've said as far as evaluating our services, history of clients out of the county, our client services on a day-to-day basis, I can tell you in the hour I spent with him last week, he was rattling some of this stuff off. I mean, I have no doubts that Mr. Kemper took all of the information that was sent to him, along with his meeting in here, and has synthesized that into what he thinks is needed, and also the strategy that he would go with doing a needs assessment anyway. The challenge for us and the problem was that the statement of work said needs assessment. It didn't spell everything out, and clearly that's what the board wanted. So however you want to approach it, and the only reason that I talked with Mr. Kemper last week is because we were at a meeting together in Sacramento. But anyone in this committee, providing that our sheriff agrees, anyone can talk with him. I am not the one and only sole person talking to Mr. Kemper, it's just that I happen to see him. So, two things. One is that whatever we put together as far as a statement of work for the needs assessment has to go back to the board for approval. So, I think putting some definition to it will be important to get the board to approve it. And secondly, Mr. Kemper is working, and that $10,000, it's gone already, because he has been working. He has been not only doing his research, but he has been meeting with and doing phone conferences with people, our stakeholders, and people that are in our services. So, I feel a sense of urgency he won't stop. I mean, he's a professional, he will continue to work. But at the same time, I don't like to have somebody working for us that doesn't have a contract. That's absolutely poor practice. So we've got to put something together that the board will approve.
Okay, Russ?
So I appreciate the good old boy network and having suppliers vendors that you trust, and I think that's great that Lee Kemper is that vendor. I do believe though that, if we're gonna write a personal check for $40,000, we probably at least write down what our expectations are. And it sounds like there's really pretty clear, not really clear, but pretty clear expectation of what we want from a report from Kemper, and it seems like he's already on the path to doing it. We just need to do the heavy lifting of writing it down the same way we would if we were writing a personal check for it. I agree with the board that we need that a little more specifics on this, and we gave them basically a 2-word needs assessment. That was our expectation of an end product that we're going to pay $40,000 for. It seems like we do need we owe our constituents and taxpayers a little more specific.
I'm not disagreeing at all. Is there anybody who would like to wordsmith that into assessing our needs? Jan?
So I just wanted to bring up the fact that in 2015, when our county passed an initiative for the Stepping Up initiative, one of the questions that is asked in that initiative of a community is, have you created a comprehensive process, analysis, and inventory of services for mental health? Now, the Stepping Up initiative, for those who aren't aware of it, is an initiative to divert mentally ill people from being incarcerated, because, as you know, that's our default mental institution. As you pointed out at the meeting, over 30% of your population are on psych drugs. So one of the comments that I forgot which supervisor made was they had reservations about spending Measure B money on this needs assessment. And so my comment was, why can't we use some of the Stepping Up money that was put aside 3 years ago for, using this process? Now, I talked with him, he didn't plan on doing a complete comprehensive process analysis, but the service inventory certainly would fall into what we are needing for our needs assessment. And so if we could just, give an umbrella statement with using the words from Stepping Up, and then perhaps having some of the details of the questions that people had submitted to present to the Board of Supervisors, perhaps that would satisfy their concerns.
Anybody else? Sure, Mark?
Sorry for missing last meeting. One thing that I'd like to mention, I think we're pretty clear on, we mentioned a needs assessment because we need a global look at our current system. So basically, I think what we need to state is that we want a gap analysis of our current mental health system, including the infrastructure, all stakeholders, contractors, service providers, patients, and that's clear direction.
Is that
We
a
can go
motion?
on, we can go on like this forever.
I agree.
I think we should sit down and bullet point what we want right now
Okay.
and create a motion and let's get this thing moving.
I just need a motion, so if somebody wants to start this and have a conversation, let me ask, and I'm gonna actually ask each commissioner a question then, as we go down the road. What is your expectation of a needs assessment? What would you like to see brought forth after a needs assessment is completed of the answers to your question? And I'm sure there's gonna be some duplicates in some of our answers, but we're gonna be able to get, we all represent a different field of the demographics of our county. And we all are looking for something, and we as individuals don't want to write the needs assessment. Well, that's why Lee Kemper or someone like him would be asked to do it. So if you don't mind, I hate to put pressure on you, but I'm gonna ask each person, each commissioner, and then we're gonna open up to the public for public input of what the needs assessment points are that they're asking, and maybe, Mark, in about 20 minutes, we can have an answer to your question.
Perfect.
I was just wondering if we have a list of questions from the last meeting from people on this committee, because it seems like that's been studying.
Good question.
Okay, while we're looking for that, I'm going to go down the road, and if you want to pass, and we'll move on. But let's start with the mental health director.
All right, so for me, when I'm looking at a gap analysis from the mental health field, we can say that we have services because we contract out a lot of services outside the county for 24-hour care costs. So I want to be really clear when we talk about a gap analysis. Are we talking about a gap analysis from what we have within our county or from what the county offers through contracted providers? I think that's a big question to ask. We know that there are some services that we will probably, no matter how big, what we develop in county, we'll need to still go outside of the county to get, because sometimes that's only the only option you have. But I think we do need to define that. Are we talking about globally within what Mendocino County Mental Health offers? And then are we talking about what we offer within specialty mental health versus private and then mild to moderate Medi-Cal services, right? Because now we're getting into a bigger system here as we look at mental health on a global aspect. I also, for me, with a gap analysis is really looking at the levels of care. So you're looking, you have your acute level of care, your subacute level of care, and then what are your transitions out of those levels of care, and what do you offer to transition out of those levels of care? And that's what you're looking at to really look at from your 24-hour care costs down to your outpatient services within your community.
Okay, well, we're not looking for solutions, we're just looking for a needs assessment to assess our needs.
Right, but you
And so the question would be, as the mental health director, would you have any specific bullet points on what our needs assessment should look at?
Yeah, all those. You need to look at the level of cares that we have, and then whether we, as a group, are those levels of cares that we want within our county, or are we saying contracting outside the county is still relevant and something we want to include in our services if we're looking at that? Your levels of care are everything, so that's my question. What are the services we need for the level of care in our county to make sure that we're providing the services clients need and we're able to step them down appropriately so that they don't end up back in custody or needing to be rehospitalized?
At either the state mental health level or the federal mental health level, has any government entity ever put out a basic expectation of services that local government should provide?
There's a requirement of services you have to provide under the mental health plan. There are requirements that you must provide these services. There's a parity act that says regardless of what your insurance is, everybody gets the same services. That doesn't really work really well. But we do have in the county mental health plan, we have to offer a required level of services, a required number of services based on your mental illness and your level of functioning. We do have to provide a specific types of services also, but that doesn't mean you can't contract outside your county to provide those services.
So is there a list of those services?
Yes, there is.
Do you think there's any way you could ask someone to email you today the list of services? And here's the reason I say that, is if we don't take care of this, as Mark said, if we don't take care of this today, it's gonna be on the agenda for June, and then it's not gonna be happening until July or August, and we're acting like any other bureaucracy. And I'm just hoping that we can get some answers today to make a motion, and we can move forward. So do you think there's any way you can get that emailed?
We can put it up on the website,
I can probably,
Okay.
I would try to get it.
So, Jan,
Well, I think that Janine really laid it out clearly. Maybe the language was something that was, a little hard for most people to understand that aren't involved in the field. But one of the problems of the money is that most of it goes out of county for people that need hospitalization. That's where most of the money goes. So if we have nothing here to provide for those people, then all the money's gone.
right.
My concern, my personal concern, is what she suggested about the lack of parity, because there's a huge discrepancy between the service that the county provides and everything else, because the only system in the county is the county system. That does not apply to anybody with private insurance. It only applies to people with Medicare, Medi-Cal, whatever it is. It doesn't, we don't have psychiatrists here. If you're on Medicare, you have access to a psychiatrist through the county system. We don't have parity, and that's a huge lack, I think, for people who are, holding down a good job and maintaining their own insurance, but they don't have any mental health coverage and services.
Okay. Dr. Barish, are there any points that you'd like to have in this needs assessment?
I think it was an important point about why the pub closed, for example, but what the problem was with the services and addressing what we did wrong that we might be doing better and how we might go about that. It would be nice to come from Lee Kemper so that, because he's had wide experience other than our county. Another point that we've lacked in our county is a spectrum of services. So what we end up having is people in crisis staying in the emergency departments, or people in the hospitals that really should be in a psychiatric hospital that we don't have. And then, whereas we have a definite idea of the necessity of having the services for these people who are already pretty far down the line, if we had a provision of services further upstream, what would it look like down here then? Like, for example, a crisis residential treatment center. And it's a little hard for us to determine since we haven't really had a very comprehensive spectrum of services. So, I think that would be another correction to come from Lee Kemper as to what his conception of what the spectrum of services would look like if it were actually able to be provided. And staffing, for example, for crisis residential treatment. But I think the staffing question is also important. And now that we have a stream of finance for providing that, maybe things could go better. I don't know. It would be nice to get his point on that.
Okay, so a spectrum of services, and then a prediction of if we had crisis residential, how much it would be reduced? Is that your
Not
question?
just crisis residential treatment, but the entire spectrum. But yes, he would be able to give us a more accurate assessment of what it would look like. For example, how many people would then need to be hospitalized in a PUF unit as opposed to what's happening now.
And one of the things about staffing is, well, Lee Kemper we're not paying him a slight amount, we're paying him a lot of money. And if we're asking him of what the legal requirements are of staffing, I think that we would, in my opinion, we would be best advised by using some of our local government employees who know the law, mental health laws of if you have a up to 16 bed facility, what is the mandatory staffing? I think we can find that out, but is that what you were asking, or is it something more than that?
Well, No, the question of how can we attract, is it just a question of salary? How do we attract, what is what is needed in Mendocino County in order to make this work?
Okay. Carmel?
Yeah. Well, I'm pretty simple with this. I think that looking at our system in total and what we don't have within our system. And I do think that looking at your comment about our clients, how many clients do we serve a day? If we're looking at clients outside of this county, how many clients are outside of this county? But if we're looking at a 24-hour psychiatric facility, how many clients do we have on a daily basis that are in a 24-hour psychiatric facility? Because that will tell us the financial feasibility of a 24-hour psychiatric facility in county. And also, I think one of the comments by one of the supervisors as far as regional services, we are focused on a 24-hour inpatient facility, and what is the financial feasibility of having services throughout the county? And we have clinics throughout the county. Is it possible that we could augment those services with measured needs? And if so, what would that look like? But the other thing that we really haven't talked about is the long-range sustainability of anything we create. Because based on this needs assessment, we could create a system that in the long run, there's not enough tax dollars in the world that could cover it. So I think we have to be real reasonable with what the needs are and what we think we can do. Measure B is what, 5 years for brick and mortar, and then we have, is it an eighth of a cent that goes forward?
Yeah.
Which I think we're estimating at $1 million. I don't think anybody in this room could say that $1 million is gonna cover any of the services that we have currently talked about. Thank you.
Ross?
Yeah, a lot of what I was gonna say, she just stole it. So, I was thinking that it would be good to get a sense from him where our gaps are, our shortages are, and how much they relate to staffing availability versus brick and mortar. So right now, the measure is specific about up to 75% of the money can go to brick and mortar in the first 5 years. And I think we need to understand, how much of that really needs to be spent on brick and mortar and how much needs to be spent on staffing. And my fear, and I actually, along the lines of what Carmel was saying, or with, I think it was McCowan was talking about different facilities, and I had a constituent contact me directly about his desire to see a more dispersed model, so maybe one 24-hour and then these small 4-bed units at various hospitals. And while I like that, and actually my boss likes that, Dan, he's at Pointy, and he likes that, but at the same time, I question our ability to staff it properly, staff those small units around, around the county properly. So I don't know, I'm hoping we can address some of those brick and mortar staffing questions in the I guess request for proposal, right? Request for quote, I don't know what you call it.
With statement of work.
A statement.
So you believe that Lee Kemper should also do the research of what the law required for staffing?
And just give us an understanding on the needs, when we're talking about a needs assessment, are our needs more staffing related or more brick and mortar? Is it lack of a space to put people, or is it a lack of people to watch the people we put in that space? I don't know.
Lloyd?
Yeah, I agree with a lot of the comments. I'm probably going to repeat some of them, but just to clarify, I do think it has to be global. We have to look at it not only in county but out of county. Look at all the players in this and make sure we're discussing all of the services we get across the whole county. And I believe really that this went in front of the voters to be a treatment answer in the county of Mendocino and not necessarily outside. So I would like to approach it as we want to do as much as we can in the county that we can afford to do.
Okay, Martin?
I personally voted for this measure that we want to see the mentally ill being treated and not on the streets. I think that's where a lot of us voters look at it. So what I'm asking in a needs assessment is what is missing in our county that is needed. That's really what I think we're asking Lee to. Once we've identified that, then we need to look at the staffing and the financial aspects of each individual item that he's addressed, and we can see what we can afford. Talking about staffing right now, we don't even know what we're staffing. So let's not talk about staffing. Let's talk about what's needed. So here's what I think's needed. We need to look at the infrastructure / services for mental health and what buildings or areas that are needed. That's one thing that I think is needed. We need to look and interview the contractors, see what's missing that they're not providing that they feel is needed. We need a gap analysis of the entire system and just say, okay, hey, we don't have a PUP unit, and how many people is that going to serve, and so on. The stakeholders, the police department, the jail, the hospitals, you know, they need to be interviewed and they need to say, hey, this is what I feel is needed. The staff and the patients, ask the patients, hey, what is missing in your life that you need? One thing that I think is missing from all of this is housing. I mean, we treat mentally ill and then we turn them right back to the street. I think that's a big one that hasn't been mentioned. And then, like it's been mentioned, a spectrum of services that if we had all the money in the world, what would we want? And then Lee brings that to us, and then we, as a committee, whittle it down to what we can afford and recommend. That's honestly what I feel we should be mentioning to Lee in a needs assessment.
Mark, I'm glad you're on this commission. Jed?
I agree with a number of things that pretty much everybody said. When this was brought up to our committee before, for each of us to write out some of these things so that we could, you know, look at them together, I came out with about 2 pages of maybe 40 questions that I thought were important, many of which have been talked about, including what are the 24-hour or emergency needs that we have, because I think we know that there's some gap that's already been identified in that area, but it needs to be much more specific. Where are services now being utilized but in inappropriate places and not cost effective, like the jails or the emergency rooms at the hospital, so being able to specify those. Another is, we know that some of the services for our local people are being sent out of county for treatment services that potentially could be utilized better, more cost effectively, more treatment effective if they were done here in the county. So those were probably 3 or 4 of, and I think my questions are available and I sent them to Lee. So again, I just reiterate, I think we've got a lot of the things that we want to know that are available. We've heard some of them. I think it's useful to be able to have them written out. And I think what was clear from talking is some of these things are appropriate and available for somebody like Lee Kemper, who I agree is very qualified. I have no doubt that he can do it. But some of the things may be ones we already know. So when I put my questions, I thought maybe that's something Janine knows that I just don't know that's known, or maybe it's something Ace knows, or there may be answers to those questions that are already known that we don't need him to research because we already know the answers. And then finally, some things that he may know that we need to be asking, that I or collectively, we haven't thought to ask, and those would be added. So I just haven't heard back. I trust what Carmel says, that he's taken all of our input and has put them out. I'd just like to know that, so I know, I don't assume that everything I asked hasn't been answered, or that there aren't other questions that need to be added, or that there are ones that he can actually do. I think if we knew that, then when he launches this, we would feel comfortable that when we get the report back in however long, 90 days, that it will answer the things that many of us have, not just us, but the community as well.
Okay, thank you. Shannon?
Well, I share a lot of the same questions and concerns of the other committee members. Extremely concerned with sustainability of a facility like this, and so like others, I'd like to see an analysis of what existing resources can be leveraged to support this facility, or facilities, I should say. Which existing resources or services should be connected to the facility. And an analysis of the location and number of facilities that we specifically need and the sustainability of those. I would appreciate seeing that location analysis in particular coming from a third-party perspective.
Oh, location as in town-specific, address-specific?
Town-specific, yeah.
Town-specific, okay.
Or region-specific, so
Okay.
South Coast or Willits or whatever. It's hard for communities to objectively look at whether a facility should be built in their own backyard.
Got it. Okay.
It's wonderful to go last.
I haven't gone yet.
Yeah, but they've said pretty much everything. I just want to add a few words. Most people know what spectrum of care means, but I want to state that that also means preventative. It means at need. It means aftercare. It means not just severely mentally ill, but also mild to moderate, because many people fluctuate between. You leave a cut unhelped, and then all of a sudden you have to amputate your arm. So I just want to make those, just want to put those words out there so that we know what spectrum and levels of care mean.
Is there anything that you would like to add that you haven't heard?
But no, because Mark mentioned clients and
Right, okay.
that, which Lee has gotten back to me, by the way, about interviewing clients and family members. So.
My answers are very similar. I certainly am concerned about the first responder aspect, a first responder of the time that law enforcement uses, not just responding to mental health crisis, but the time that we're spending at the hospitals, whereas we wouldn't spend that time at the hospital if we had a psychiatric health facility. I'm concerned about numbers, and not concerned, I want everybody to know the numbers in the jail, specifically not just people who are taking mental health meds, but I want the public to know how many 5150s, someone who's danger to self, danger to others, gravely disabled, are in our correctional facility, and to see if a psychiatric health facility would be able to decrease that. We're never going to be able to take all 5150s out of the jail. If we have a violent murderer who's 5150, the jail is very possibly the best place to keep that person in custody as they go through their court proceeding and their mental competency procedures that is administered through the courts, and the emergency rooms, of how many people are going in the emergency rooms, and from the emergency rooms, where are they diverted? Are they diverted now out of county? Are they diverted back to their houses? There's some numbers there that we actually have to work on. And one thing that I think that is very important to us is we have to ask Lee Kemper, and I don't think it's unreasonable for us to ask him, based on his experience and his education, of can you predict from the population of our county in 20 years where you think we're going to be? And the reason I ask that question is, let's say we make a recommendation to the Board of Supervisors to build a 6-bed psychiatric health facility for severe psychiatric patients, and then in 10 years we have 10 per day, and we say, why weren't we thinking of the number 10 back in 2018 when we recommended 6? So I'm asking for him a little bit of crystal ball work of making a prediction of what the number we're going to need in 20 years. I'll use the timestamp of 20 years of predicting where we're going to be. So, Mark, I'm going to ask you, and you started this conversation today, right now. I'm going to ask you if you would mind putting everything you just heard into some kind of motion.
No pressure. Yeah, well,
Some kind of
remember I
motion.
tried to do this 2 months ago, and
Well-
we ended up with what we have in front of the board that they didn't like. So maybe I'm not the best to culminate this information and put it into a motion, but I'll be the first to second it.
Second, okay. Jan.
Okay, I'm making notes here. So I would move that we ask Lee Kemper to create an inventory of services for the spectrum of mental illness and levels of care, and include a global gap analysis of current services and what is available in county versus out of county. That's what I have so far.
That's. She wrote it down.
Can I have that?
So,
Or you can read it.
so does anybody have any questions about that motion? Anybody would like to add to it?
Yeah, Sheriff, the only thing is you want to add to that motion, so you want to revise this, you want to develop a statement of work. And then, do you want that to come back here first, or does it go straight to the Board of Supervisors for approval? Which I think, you know, in light of timing, it would probably be good if we could do something to get the contract developed. This has to go to the board for approval,
Right.
so
So what words did you need in there?
that you would add to, everything you said was perfect, and then say, and, either return to the Board of Supervisors for contract approval. Which you have to do.
I would like
Okay.
to add some to that, Jan, if that's okay.
It's gonna be part of.
Sure, there's not a second, so it could be amended.
Well, it can be
Okay.
amended first and second.
Yeah, I was thinking we should add infrastructure and the stakeholders, all stakeholders involved, which that's pretty wide open.
Stakeholders.
Well, that's everyone that's involved in the process. You want, is that not clear? Okay.
So I got the infrastructure part.
Infrastructure, okay, contractors, healthcare providers, law enforcement, healthcare providers,
So-
those are the stakeholders.
Okay, so then are we going back to a comprehensive process analysis? Because that would include all the stakeholders. We didn't mention courts who are also involved.
Well, I think we need to look at all this, the entire system to decide how we're gonna spend our money, that's my.
So if I could make a suggestion, now we have a motion without a second right now, but I'm going to make a suggestion that the video that's being prepared right now, we ask Lee Kemper to watch. And I think Lee Kemper is going to read what our motion was, and hopefully a second soon. And Lee Kemper will understand what every commissioner is talking. And we haven't opened it up to public, but I'm going to. I know we have a motion on the floor, and I should have opened up to public before a motion on the floor. But is there any public member who would like to address this? Mr. Marmon, yes.
Yeah, I understood the Measure B was a facility tax. So, I suggest that we have Kemper look at what types of facilities we need first, and second, whether we can afford them, and whether they're sustainable. He could look at that in a gaps analysis. I just pulled up license staffing requirements for a PUF unit. And then the state tells you, what staffing you need for what size facility or what type of facility you want. I think this group could probably answer a lot of those questions without Lee Kemper doing that part as far as what we could afford. But this was a facility tax, so we need to figure out just what facilities do we need, but whether one would prevent the need for a larger one here or whatever. So that's just a suggestion.
Thank you, Mr. Marmon. Is there any other first member of the public who would like to voice? Yes, just go there and state your name, please. Welcome.
My name is William Lynch, and it seems like there's when you look at this entire cycle, like prevention is something that I think you're lacking some focus on, and addressing also the needs of people who have addictive behavior. And I think you have a lot of dual diagnosis with some of these people who are addicted to alcohol and drugs, who can't afford to take their medicines or have their education. I mean, they're doctors working with them to work their program to stay healthy. And I think if you look at a private-public partnership where you can share the risk and you can share the reward, you can use state and federal funds as far as, and also personal funds and foundations and trusts and whatnot. But it seems like you're sort of ignoring the entire issue of addiction. And when you're looking at people who are truly mentally ill, who have these special needs, they're here. But a lot of these people are beginning with addiction and moving into serious neuroses and psychoses and stuff from drugs. So I think that's something you guys should look at.
Okay, Mr. Lynch, thank you very much. Any other member of the public? Yes.
My name is Stephanie O'Flaherty. I was here a couple months ago, and I have quite a few things that I could probably help you guys out with. First, I live in some mental health housing. It's through HUD. It's on Gibson Street, and it works quite well. When we first opened it, it was supposed to be an on-site manager, which is no longer going. But my apartment complex is very familiar with the Sheriff Rallman's guys. But you have to have a mental health diagnosis, and you have to be working with the case manager through Redwood Quality Management. And right now, Redwood Quality Management, to my knowledge, is pretty much what's available to me. I'm going from a private doctor, psychiatrist, to Redwood Quality Management. I'm going to see a lady by the name of Dr. Haley, and she is on a screen, telepsych, which is not the best thing for me. I think it's a really sterile process for me to have to talk to somebody who's going to help me that's not in my county. I went up to the Mendocino clinic, or Law's clinic, and I was told that I am too sick to go there, that I have to go to Redwood Quality Management. I have been hospitalized 9 times, 3 times last year, all out of county. And the best hospital was St. Helena Vallejo. They offered me doctors, psychiatrists, social workers, aides to run the groups, dietitians, case managers, and nurses, etc. And all the other ones did not offer all that care. And I am on a rebound being the best help that I've ever been for a long, long time. So you can take that into consideration. I appreciate it. Thank you.
Thank you, Stephanie.
Thanks, Stephanie.
Is there anybody else who'd like to speak? Okay. So we have a motion on the floor. Is there a second?
Well,
Wait.
I don't have the details of the motion. Can you have it?
Yeah, want me to reread
Or reread it?
Agree Road? Yeah.
Whatever works.
Okay,
Yes, go ahead.
I move that we recommend to the Board of Supervisors,
Yeah.
that Lee Kemper conduct an inventory of services needed for serving individuals suffering from the spectrum of mental illness and the levels of care. This would include a global gap analysis of current infrastructure and services, and request his recommendation for the best, that's right, the best way to meet the needs.
Okay.
I'd like to see sustainability in there some way. And I've never worked with Lee Kemper directly, and I assume this is obvious to him, but that we could come up with some pie in the sky recommendations of what we need and find that they're not sustainable for us.
Request his recommendation for sustainable.
Solution or sustainability or, yeah, whatever.
Service sustainability.
Services.
Yeah.
Service
Sustainable
sustainability.
services.
Just say service sustainability.
For service sustainability.
And again, I'd like to lobby for inclusion of an analysis of location or locations for the facilities.
A global gap analysis of current infrastructure and services by location?
Do you want to talk about geographic specific demand? It seems like that's what you're sort of saying, right? It's like,
Yeah.
where are these people that need these services? Are they, mostly in Ukiah? Are they mostly in
Right.
on the coast?
Is it important to have remote facilities, or can this be one centralized facility?
Services and locations?
Sure. All right, so now, would we like for Jan to read it again?
Can you go slower?
No, but she's gonna give it to you. She's gonna.
Okay. Yeah.
You see that?
Don't add anything to it, please.
All our touches on it.
I know, yeah.
God.
Everybody's DNA's on it. All right, so we have a motion, and Rose is going to read the motion. We do not have a second yet.
Motion to recommend to Board of Supervisors that Lee Kemper conduct inventory of services needed for serving individuals suffering from the spectrum of mental illness and levels of care. This would include global gap analysis of current infrastructure, services, and locations. Request his recommendation for services sustainability.
Okay, so that's the motion. Is there a second? Mark? I'm sorry.
No, I could be wrong, but it seems like the way it reads says like an assessment of current locations. I just wondered if it needs to be wordsmithed.
Well, it was the current infrastructure, services, and location. We could, so services.
I'd like an analysis of proposed facilities, not just the.
So then a recommendation for proposed services and
locations.
sustainability.
Yeah.
Proposed services. Sorry, Rose, the last sentence. So his recommendation for proposed services, locations, and sustainability. Right?
Proposed services.
Locations
And recommended.
You recommend locations and
Recommend, his recommendation for sustained services and location.
Maybe you should reread it once you get that.
So you're saying both conduct inventory of proposed services?
No, that was the first part. This would be the recommendation at the end.
This would include then global gap analysis
So it would
of
include.
current infrastructure.
Right.
So where it says services, you're saying?
No, this is at the end, under asking his recommendation for.
Okay, so request his recommendation for
Proposed services.
proposed services, locations,
And
and
sustainability.
sustainability.
So it would be proposed services, service locations or facility locations, whatever. And, service sustainability.
Thank you.
and service sustainability. So request his recommendation for proposed services, service/facility, locations, and sustainability.
Service sustainability.
Services sustainability.
Perfect.
Got it.
Can you read the whole thing, please? I think you did a great job.
Recommend, motion to recommend to the Board of Supervisors that Lee Kemper conduct an inventory of services needed for serving individuals suffering from the spectrum of mental illness and levels of care. This would include global gap analysis of current infrastructure, services, and locations. Also request his recommendation for proposed services, service/facility locations, and services sustainability.
It seems like the service and locations at the end of the first sentence was the one we were trying to get rid of and fix by putting at the end. Sorry, I found it in front of me. So,
The way it's written, I think everybody's gonna understand
does
it.
it work?
I think it's okay. Don't worry about it.
All right.
Okay, so we have a motion, and was there a second? Mark?
I'll second it.
Mark, second.
You promised.
Any discussion? Any more discussion? All right.
Sure,
Yes.
maybe just some clarification. So what should go to the board now? Because basically now we have to do a Lee Kemper contract and then do the statement of work. So the statement of work for the Lee Kemper contract for the needs assessment will include that language that's in that motion. And then that language in that motion will be what's on the agenda summary. And that's the best I can do.
Right, I think that's outside the realm of this committee, though. As it started, we're recommending to the board that the board do this. And the board's the one in charge of making sure the contract is proposed and making sure Lloyd has the money to pay for it through the right line item, right?
So when we go to the board though, the first thing that will happen, honestly, as far as process, is this is a great motion that's come out of the Measure B committee. The first thing is that Lee Kemper needs to be contacted with this motion so he understands essentially the enhanced or new statement of work. So somebody here has to contact him. And then, once he agrees to that, then the agenda item will be developed along with the contract, and then that will go to the board. And so we're looking at, we're probably looking at June 19th.
Well, we haven't even passed the motion yet, so if it passes, June 19th.
Okay, thank you.
Ross?
Good enough.
So on that, if he doesn't agree to it.
Comes
and
back here.
Comes back here, actually, would it need to come back here, or could he iterate it with the board?
Well, honestly,
This is a painful process to
it's
go
gotta,
through
it's
right
gotta
this
come
second.
back here because you don't want the statement of work for Lee Kemper to be out there that this Measure B committee didn't agree to, right?
Ultimately, the board's decision, we're just making a recommendation.
Okay, then the Measure B committee should decide. If Lee Kemper will not agree to the statement of work and will take half of it out, or, the chances of him agreeing are probably pretty good. He's not gonna wanna get into the detail. He's not gonna tell us how many staff we need. He's not gonna get into that stuff. He's gonna really try to keep this at a high level. Service, so maybe it's a moot point. I'm trying to make sure we don't have like 30 extra steps, that we can get everything done with one step. So if the Measure B committee is okay with it, whoever talks with Lee Kemper and gives him this information, if he doesn't agree and there's some changes, can that go straight to the board or does it need to come back to this committee?
Does not need to come back to us.
Okay, we're good to go then.
I agree.
We're okay with that?
Okay, very good.
Okay, so we have a motion and a second. All in favor, please say aye.
Aye.
Any opposed? Hearing none, it carried unanimously. Okay,
Just a point of question. You had mentioned earlier, Sheriff, that Lee Kemper would be given or would have the film meeting that he could see so he could hear from everybody that's spoken. How does that work? Does he automatically get a copy or does somebody?
well, I'm gonna
send it to
actually
him?
recommend that a copy of this meeting go to Lee Kemper.
Right.
And associates to, I want him to hear what each commissioner said.
Good.
So if Rose could send it, if she could contact him and send it, let's.
Okay, and Rose will get it from IT. Thanks.
Great, thanks.
All right, we're moving on to agenda item 4, D as in David, needs assessment progress report. With discussion and possible action, I think we just took care of that, we combined number 3, or C, with D. I have nothing else to report on an assessment progress report, nothing else. Is there any discussion at the commission level? Is there any public comment on item 4D? Jan?
I just want to make a point from one of the public comments concerns with the addiction process, that usually when they do these analysis of mental illness, they include co-occurring disorders, which is so obvious in our county because if we don't have services, people are going to self-medicate, blah, blah, blah.
Thank you. All right, we're getting towards the end of the meeting. Item number 5, committee member reports. Each committee member will have the opportunity to report out on any actions they have performed since the previous meeting dealing with the Measure B Commission. Can we start on this side since we always start with you? All right, Donna.
Oh, sure, I don't want to be first. Actually, mine's pretty easy. Lee Kemper has been in touch with me and I am getting him some contacts for family members and peers for him to contact regarding his needs assessment.
Of the clients.
Clients and family members, yes.
Family members, okay. Yeah.
I have nothing to report.
Jeff?
Yeah, I've been talking to community people in and around Willits and 3rd District. I spoke to Stephanie, she was at the meeting, the city manager of Willits. We talked about my coming to city council meetings to provide, input to the community. Georgianne McCroskey, who's the 3rd District Supervisor who appointed me, is planning to be at the city council meeting, I believe, tonight with me, and I think some other members of this board have been at least invited to the meeting. So for sure, I will be there and will continue to share with anybody who wants to contact me or talk to me about what we're doing that's in anywhere, but specifically in the 3rd District.
Thank you. Mark?
I don't have a lot to report. I just want to reflect back on some of the readings that I read for the past meeting that I missed. When you talk about mental treatment facilities, nobody wants that in their backyard, period. And I totally understand. But my input, my standpoint here is that a lot of people are ignoring a problem in society, and we all have to step up and take ownership of that. And finding the right spot is going to be a difficult choice, but I think we all need to realize that we're trying to do the right thing, and we're trying to look at all options on the table, not just a option on the table. So that's all I have to report.
Lloyd, report out?
Nothing to report out. As I've told you before, we are expecting the first revenues from our tax to arrive in early June. So I will keep this board abreast of the balances we get as we get them, so we can plan our expenditures appropriately.
Would you like for that to be in a regular agenda item, or?
I could just do a cash balance report.
Okay.
At the beginning of each meeting or something.
Oh, okay. So we'll talk to Dora on that, yeah.
She can include it in the agenda somehow.
Okay. Ross?
Along the lines of what Mark's talking about, I think it would be valuable, and I don't know where to get the data points, but it would be valuable to have an understanding of what a new facility would cost. There's obviously a lot of talk about Howard Hospital, and there's some pushback from the folks in Willits, and like Mark said, nobody wants that. Nobody wants it in their backyard. I get that. But I think we need to have a discussion or need to have an understanding. It's like, they're talking $12 to $16 million to refurbish an existing iPod? No, not iPod.
Oshpod.
Yeah, Oshpod, sorry, Oshpod facility. And to build a new one, I'm thinking might be, what I seem to have gathered might be north of 30 million.
He said 3 times what his estimate was. Yeah.
So that being the case, we need to have some thought. I would love to ask Carmel, the board, how much general fund money would they want to kick in? Because somebody's going to have to put a lot of general fund money, a lot of money into it if that's not going to be the facility. There was a constituent I talked to that recommended or opined that there's these small facilities you can get for $1 million, and they're 4 beds, and they're suitable for this kind of thing, and they're OSHPD compliant. I haven't seen that. I question it, but at least have that and be part of the discussion. But certainly, part of the discussion needs to be, it's going to be 3 times, say, $45 million. It's like, unless the board really wants to get everything else, that's not happening. And I think we need to know that.
Just a quick comment, Ross. I think the idea that nobody wants mental health facility in their backyard, I don't think it's quite accurate. I think there are people that have concerns, some of them are in Willits, about the nature and what's going to happen and how do you take care of people. So I don't think that's the idea that just, somewhere else, we want it somewhere else. A lot of people understand the need and I think are responding to it and have some, some concerns that need to be addressed.
Of course.
Yeah. I'm sorry, didn't want to interrupt.
Yeah, thank you. My only comment is that I think when Measure B passed, the expectation was that Measure B would be covering a facility or whatever the service was going to be. And the reason for that, of course, was that there is no general fund available to add to the mental health system. If there was, it would have gone into the mental health system already. So, and this committee is to manage Measure B. There's no other funding this committee manages, but the general fund is just not available. And given Jan's comment, which was a very good comment about the Stepping Up initiative, I don't know where that $150,000 is, and so maybe Janine knows, maybe it's still in HHSA or mental health's budget. I don't know, but that would be a decision of the mental health board. So we wouldn't make a decision on the Stepping Up initiative dollars. It's not Measure B dollars, so that's all I'm saying, that would be something that would go to the mental health board if that was an option, so that's it.
So, like Jen, I've been engaging in discussions with people in Willits, and we'll attend a city council meeting tonight, thinking about people's concerns.
Right.
Well, I have done a number of things, they're all kind of connected, So I went to the Board of Supervisor meeting on May 8th where the department presented and Sheriff Allman presented. And as he noted, we are not front page news, mental health is not, because they put our Janine's report at the very end of the meeting, and I just wanted to make public comments in a 3-minute talk, and I was up for 5 o'clock when I finally got there. On May 16th, the Behavioral Health Advisory Board met in Willits, and as you know, that is a board that's required by MHSA, and we have a period of public comments where people can talk about their concerns about mental health in the county. Nobody from Willits was present. The meeting was held in Willits, and I made a point of putting posters up all over town. The board did tour Howard Hospital in groups because we didn't want to violate the Brown Act. Last Sunday, which Donna declined to comment on, I helped her paint the new NAMI office, which is exceptional, and she's done so much work on that, which is really going to be a resource that all people can call upon. Yesterday, I went to a talk at Consolidated that was sponsored by the county for Mental Health Month. May is Mental Health Month. On stigma smashing, which was a wonderful talk by a young lady who recently produced a TED Talk, which will be available. It was very sparsely attended. No one was present from Willits, but it will be on the website on the county. So I suggest that you guys take a look when it's available, because this is a young woman who's really, really brilliant and suffered from mental illness and just went through the whole process and is able to explain it and is a peer mentor and has started peer mentoring programs and is a wonderful, wonderful person to learn what the process looks like when your whole life is turned upside down.
Where is that available? Did you say it was filmed or it can be seen?
So she did a TED Talk, and then we filmed her presentation, and so it'll probably go up on our website, the behavioral health, mental health side of the website.
Gotcha. Anything else, Jen?
What's that?
Anything else?
No, thank you.
Okay, Janine.
So I have also been talking with Lee Kemper and providing him some stuff. And then I had that quick list for you if you want to hear what the list of services are. You guys will probably have a lot more questions, but I will quickly run through. And if I missed any, sorry, most of this is from my head.
And then this is a list of state requirements.
This is a list of services that through the county mental health plan,
Okay.
we offer based on your level of care need, your diagnosis, and your level of functioning.
Okay.
So based on all those things, these are the different level of services we offer. But remember, this is for the county mental health plan, which means you're seriously mentally ill.
That are on Medi-Cal.
And they're on Medi-Cal. It doesn't address like private insurance, VA, Kaiser, the mild to moderate population. So just really quick, what we offer through county, psychiatric inpatient hospitalization, crisis residential treatment, adult residential treatment, crisis stabilization, day treatment, day rehab, case management, therapy, assessment, plan development, rehabilitation services, collateral services, medication support services, crisis intervention, intensive care coordination, intensive home-based services, therapeutic behavioral services, and linkage. Did I miss anything? Intensive care coordination.
So I would like for that to be attached to next month's agenda. So everybody in this room, in this commission, actually is interested in every one of those. So if you can get a copy to us. Yeah.
Or Dora.
Or Dora, yeah. Anything else? Okay. As far as the stepping up, the 150,000, the sheriff's office has been meeting with mental health. We have 3 two-day sessions planned in September where first responders, not just law enforcement, but first responders, ambulance, fire, and law enforcement will be attending crisis intervention training with the $150,000 going to, a good portion of it going to backfill our overtime needs to get, whenever you pull people in for training, you have to fill their spots back on the street. And so there is going to be expectation, but if that money is not going to be available, I need to know as soon as possible so I'd be able to cancel the training or.
I don't know.
Okay.
I was really asking.
Okay, well, we had a meeting with mental health, and so we're certainly not gonna need all of it, but, you know, when you start getting the 3 police departments and CHP and the fire departments, it certainly adds up a lot. The sheriff met with the governor last week regarding the many things, but one of them being AB 109 and the mental health concerns that we have with state prisoners that are being put out into local communities that would have in the past been receiving mental health work at the state prisons, but then they've been released. And so the impact on us is having an impact certainly not just at the jail, but the 3 police departments as well. And the governor, he's a very thoughtful governor when it comes to mental health. The governor seems to, if you give him a problem and give him about 2 months, he comes up with a pretty darn good solution. So we meet with him again next month, which brings me to the my final point. And on June 27th, which is our next meeting, June 27th in this room from 1 to 3, or 1 to whenever we get out early today. I will not be here because I'll be with the sheriffs at a meeting out of county, but Dr. Barish will be, he's a co-chair and a vice chair, and he'll be running the meeting. And so I will not be here next month. So, is there anything more for the good of the order? Did you forget anything? Oh, I'm sorry, the minutes, yes. Hold on 1 second. Has everybody had a chance to look at the minutes? Would anybody like to make a motion to approve?
Well, I have a comment about the minutes.
Okay.
So there was a comment by Wendy Roberts who spoke last meeting, and I didn't think that the summary of her comments was accurate. there was an article in, I forget, was it Willits News that summarized her comments much better.
Okay, then I'm going to make a command decision that we are going to put April's minutes for approval on the June agenda, and that we can, we're not going to spend 20 minutes of discussing what was said. So we will look at that, we'll go back and look at the video, and we will have the April and the May minutes on the June agenda. So we didn't have a motion, did we, for the minutes?
No.
All right, if there's nothing more, meeting adjourned, thank you.